Good afternoon, everyone. Welcome to today's COVID-19 update in Alberta. With us is Dr. Deena Hinshaw, Alberta's Chief Medical Officer of Health. Dr. Hinshaw will provide a brief update, and then we will open the floor for questions.
Thank you, Shireen, and good afternoon, everyone. I'd like to start today's update by sharing this weekend's data with you. For the 24 hours starting on Friday, August 21st, we identified 83 new cases and 2 deaths. The provincial lab completed 10,175 tests. For Saturday, August 22nd, we identified 106 new cases and no new deaths. On that day, there were 10,098 tests completed. Finally, over the last 24 hours, we detected 69 new cases and 2 deaths. There were 8,489 tests completed. My sympathies go out to all who lost loved ones this weekend, whether to COVID-19 or any other cause. Today, there are 1,172 active cases in the province. 45 people are in the hospital, including 9 in intensive care. In all, 11,600 Albertans have recovered. I also must report several outbreaks of note in the province. Before I list these outbreaks, I want to emphasize that each one of these locations is working closely with public health to prevent further spread. It is imperative that these locations and their employees not be stigmatized or targeted because they are being transparent and proactive. Sharing this information ensures we are communicating with the public about trends. Unfairly targeting any worker or activity participant is counterproductive and risks driving COVID-19 and sickness underground. Those involved in any of these outbreaks are cooperating with public health to limit the risk of spread to others. At health facilities, the Peter Lougheed Centre in Calgary currently has 5 active cases. The Grey Nuns Hospital in Edmonton has 2 active cases. The Good Samaritan Southgate Care Centre now has only 3 active cases and 80 recovered cases. Sadly, 2 of the deaths over the weekend were at this facility, bringing the total deaths there to 31. At religious gatherings, the event in Deadwood near Manning is now linked to 7 active and 10 recovered cases in Alberta. The Bible Pentecostal Church in Edmonton now has 75 active cases with 2 recovered. At workplaces, the Lilydale Chicken Plant in Calgary has 11 cases and 2 recovered, and the Cargill Case Ready Plant has no active cases. Alberta Health Services has confirmed 3 positive COVID-19 cases in staff members of the HealthLink team. Contact tracing is underway, and there is no significant staffing impact to HealthLink at this time. I note that Edmonton still leads the province with 631 active cases. As we've seen Edmonton numbers rise, I've received many questions from Albertans looking to understand why. I have been working with my team to find out more about what is happening. Today, I can share some details on trends we're seeing that contribute to these numbers. The reasons are not new, and there is no one single factor. Primarily, we're seeing growth in cases linked to gatherings, weddings, funerals, family reunions, prayer meetings, informal gatherings of friends, backyard parties, and community groups. There has been a particularly high attack rate in family gatherings. Social connection is vital to our mental well-being, and I know that we have all missed these activities immensely. We crave hugs with grandchildren, we want to share meals, and we are keen to catch up with our extended family members. We miss our aunts and uncles, cousins, parents and grandparents, and we're tired of only connecting through telephone or video chats. We are hardwired to want to be together. However, when organized by even the most well-meaning family members, it can be challenging to maintain physical distance with loved ones, or to ask your parents or grandparents to wash your hands, and to ensure that nieces or nephews who are sick stay away and don't come. It's natural for families to want to move gatherings indoors when the weather cools, to sit close together, to hug one another, and to share food. When we let our guard down, the virus has its opportunity. It is possible to hold a safe gathering, and when we do, we must be diligent in ensuring proper infection control protocols. Keep gatherings small and meet outside rather than inside whenever possible. Asking someone to wash their hands or reminding them to maintain 2 meters of distance is the most loving thing we can do for each other at the moment. I also urge the hosts of any type of gathering, big or small, to keep a written list of attendees for at least 2 weeks. It may seem silly to write down which family members come over for a visit, but quick access to accurate information speeds up contact tracing immensely. Keeping this type of information will not get people in trouble, and it has the potential to save lives. Today, I want to remind families that if they are choosing to send their children back to in-school learning, they need to be extra vigilant when considering family gatherings with older relatives. I've said it before and will repeat it today. While children are less likely to have severe outcomes with this virus, they can pass it on to older family members who are more susceptible to severe outcomes. Albertans have a civic responsibility to protect our elders, which unfortunately means considering moving to virtual visits with Grandma and Grandpa as school starts up. While this is a sacrifice, and it may be hard for grandparents, parents, and grandchildren, it is the right thing to do to have these conversations as we move into this next phase of reopening. In addition to encouraging safe gatherings, I would also like to speak directly to younger adults today. It is easy to feel invincible and believe that COVID-19 is only a concern for older Albertans. It is easy to forget the virus's potential to cause harm if you don't know anyone who has suffered from it. It is easy to believe this is someone else's issue. You are less likely to have severe outcomes from a COVID-19 infection, but because of the way the virus is spreading in your age group, you are now more likely to pass on this virus unknowingly and to do so rapidly. We are seeing this in Edmonton right now. You must keep your circle of friends small to protect others from the virus. Your circle of friends needs to be doing the same. Sunday afternoon's brunch and Wednesday's dinner, combined with last night's drinks at a local bar and a midweek movie at a friend's house, each with a different group of friends, means a large number of contacts. While none of these activities individually are problematic if they're occurring with the same small group, when combining different friend cohorts, they create many exposures and contribute to contact tracing challenges. Be wise, wear a mask, maintain distance. Wash or sanitize your hands regularly. If you are meeting up with different groups and anticipate it will be hard to follow public health guidance, keep groups small. Plan to gather no more than once a week at most to reduce the chance of many exposures. Meet up outside instead of inside whenever possible. Critically, if you're feeling even a bit under the weather, don't go out. Stay at home and arrange to be tested. And although we're seeing these trends in Edmonton right now, tomorrow they could be in other communities. By looking at the overall case numbers, it can be easy to think of COVID-19 as a city problem and that the virus will not show up in rural Alberta. While 987 out of 1,172 current active cases may be in Edmonton and Calgary, this overall number does not tell the complete story. There are 185 active cases right now outside of Edmonton and Calgary. And when precautions aren't taken, we have seen even a single case quickly multiply to many more. Even though the majority of current active cases are in large cities, there are a number of rural communities with high case rates in comparison to their population. These have affected people going about their daily lives, in workplaces and continuing care facilities, and while participating in different kinds of gatherings. I do not say this to be alarmist or suggest that any community is doing something wrong. I say this to make the point that COVID-19 is not limited to any one region in the province, and to remind us all that rural communities have not gone untouched. We must all continue to avoid crowded places and close contact with those outside our household or cohort, and to stay home and away from others when we are unwell, regardless of where we live. Whether there are only a few cases in your community or your community has not yet had a confirmed case, COVID-19 can spread rapidly if given the chance. Some may think that there is no way for them to get COVID-19 since they do not know anyone personally who has had it. But we need to remember that no Albertan or community operates in isolation. Albertans regularly travel into neighboring towns or cities to run errands, shop, attend appointments, sell goods, or visit loved ones. While these are necessary outings, they can potentially result in transmission and introduction of COVID-19 from one community to another. It is also important to be aware of any additional restrictions, such as mandatory mask bylaws, that may not be in place where you live, but which may be in effect in communities you are traveling to. The same can be said to Albertans visiting rural communities. I know many Albertans may live and work in larger towns and cities, but regularly go to their hometowns on the weekend to help with family responsibilities or to visit. It can be easy to get comfortable and feel like you can take a break from being careful since it seems like no one in town is sick. But the most caring thing you can do when you go home is to remain vigilant. And as we enter the final weeks of summer, there are still many Albertans vacationing in summer communities, visiting the mountains and beaches. I encourage all Albertans to be respectful of smaller communities and take precautions to prevent potential exposure to COVID-19 or spreading it if we have been unknowingly exposed. I want to be clear, I am not trying to create an us versus them mentality between rural and urban or younger and older Albertans. The message here is that we all still have a responsibility to protect one another. Although I am sure we all wish there was another way, our caring actions are still each other's only protection. Thank you, and I am now happy to take any questions.
We'll go to the phones now. Operator, please put forward the first question.
All right, first is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. Where are things in terms of the outbreak being declared over at Good Samaritan Southgate, and how long do you expect the single-site rule exemption to last at that particular site? Are there concerns about staffing levels once that exemption is lifted? And also, Hong Kong researchers are reporting the first case of reinfection where the individual had two separate strains from different parts of the world. What does this say about attempts to find a vaccine for the coronavirus, and what should Albertans take away from this?
All right, I'll try to answer all three questions. So the Good Samaritan Southgate outbreak, the last case, I don't have it in front of me, but the last case to be diagnosed was earlier this month. So the end of the outbreak would be 28 days after that last case was identified. We wait 2 incubation periods with no new cases before an outbreak is declared over. And we can follow up and get you that exact date with respect to if there are no new cases when that outbreak would be over. The staffing exemption is currently, it's been written to be in place until August 31st. We'll be watching to see if there are still staffing challenges, if that exemption is still needed. But I anticipate as soon as the outbreak is over that there will be no additional staffing challenges. We're working closely with Alberta Health Services and as they are with the Good Samaritan group to find out what that trend is like and to make sure that staffing is back to normal and that the residents get the appropriate care, which is the reason, of course, that the exemption was put in place in the first place. The third question about the first reported case of a reinfection. It's difficult to say at this point. This is, as you noted, the first case that's been reported in the literature of a reinfection of someone who's been infected with one strain and now appears to be infected with a second or different strain. And we'll watch this closely, but this is a single case report, and I think it's too soon to know what, if any, impact this may have on, say, vaccination or other control measures.
Operator, please put through the next question.
Next is Jackie Perez with City News Calgary. Go ahead, Jackie.
Hi, Dr. Hinshaw. As kids head back to the classroom, is there a threshold on the number of outbreaks and COVID-19 cases that need to be seen before ordering schools to close? And if so, who's making that call?
We're working right now with my team to, again, look at other jurisdictions, see what experiences have been like in other places. to determine, again, those kinds of metrics. We will, of course, be watching closely for any outbreaks in schools, any cases in schools, and so those thresholds or metrics, again, have not yet been determined, but will be part of a discussion between health and education as we look at and learn from other jurisdictions.
Just a reminder for everyone, please keep your questions to one at a time. Operator, please put through the next question.
Next is Shannon Scott with CBC. Go ahead, Shannon.
Oh, hi, Dr. Hinshaw. I'm wondering if you can tell us a little more about the outbreak at the Peter Lougheed Hospital, if we know how it started, what's being done to try to keep it under control.
The information that I have from Alberta Health Services is that there were several staff and 3 patients on the same unit who were identified to have COVID-19. The patients have been moved to a location where they can be adequately isolated and cared for. And of course, the staff who are cases are also isolated. I'm not sure exactly the source of the outbreak. That I think is still under investigation. Alberta Health Services may have more information about that. But all of the outbreak protocols with respect to limiting admission onto the particular unit that was affected, and I should specify that it is just one unit that seems to have been affected at this time. So that unit is not receiving new admissions, and again, all staff and patients who are affected have been put into appropriate measures with respect to either isolation, if they're a case, and any close contacts are being put in quarantine to make sure there's no further risk of ongoing spread.
Operator, please put through the next question.
Next is Carrie Tate with the Globe and Mail. Go ahead, Carrie.
Hi, Dr. Hinshaw. Thanks for taking my question. Today's data shows it looks like a new case in the ICU with a 4-year-old, as well as other cases previously with 2 people under the age of 19. What can you tell us about these cases? Were there underlying conditions? Are they recovered? What has their experience with children been compared to adults?
The detailed information around specific cases we're not able to share for confidentiality reasons. With respect to the overall trends, I don't have current information about that. What I know about the cases that I'm aware of who have been younger, who have ended up in the ICU, is that there were certain risk factors. And that's something that we can take away with our analytics team and see if we can put together a list of the general kinds of risk factors that we have seen. One thing I'll say, not necessarily from our own experience, but what we've seen in other jurisdictions is that there does seem to be a link to things like smoking or vaping and having a more severe outcome following a COVID-19 infection. So it's a good reminder for those who are interested in cutting down or quitting those activities to look at the supports that are available, like the Alberta Quits Helpline, and consider ways to, especially for those, obviously this is more for those who are teens who are vaping or smoking, that this is a great opportunity to think about supports that are available to them to quit, to reduce the chances that they may have a more severe outcome should they become infected.
Next question, please, operator.
Next is Michelle Bellefontaine with CBC. Go ahead, Michelle.
Oh, hi, Dr. Hinshaw. I just have a question about the HealthLink outbreak. There was 3 staffers that have positive tests. The UNA local that represents them is asking for on-site testing. And I'm wondering if this is something that Alberta Health is considering for this site.
That question would probably be better directed to Alberta Health Services. So we wouldn't have a policy at the ministry about whether or not to offer on-site testing. We do recommend, if there are sites that provide on-site testing, that they ensure that it's voluntary, especially for those who have no symptoms. So that would be the one caveat in terms of a policy requirement, but that would probably be a better question for Alberta Health Services as to whether or not that on-site testing is being considered.
I believe we have one last question in the queue. Can you put that one forward, operator?
Yes, our final question is Lauren Boothby with the Edmonton Journal. Go ahead, Lauren.
Hello. I was just wondering if you could tell us about how teachers have been responding to the call to get testing for COVID-19 before going back to school, how that's been going.
What I understand from the reports is that there are many teachers and school staff who have gone to get tested. I don't have a specific number, but I'm told that there are many who are listening to the recommendation and going out to be tested. And so we know that we've had significant volumes of testing in the last week or so, and it's likely that that's being driven partly by the response to this particular request for teachers and staff to be tested.
Thank you everyone for joining us today. Dr. Hinshaw will provide the next update on Thursday.